it has helped a lot to ease the burden of the nurses in respect to the monitoring, continuous vital signs monitoring of the patient who require close monitoring, not in the ICU setup, rather if they are in the wards and they are inside their rooms. It really helps a lot because they don't have to go and knock the patient and disturb them every now and then, and the alert comes to them on their desk or wherever they are. It helps, like the efficiency increases because they do not waste their time in running up and down to the rooms and coming out of them, and they can see the monitor the patient even during the night times without disturbing their sleep. So it has really helped in that way. Definitely, in regards to the hypotension or hypertensions, and plus the variations in the SpO2, when it goes below the limited parameters which has been put up in the records, the nurses can alert the physicians, and the nurses themselves are alerted ahead of time, so that many of the code blue alerts are reduced because of this. And we get ample time to discuss about the scenario of the patient before even we get to that actual code blue scenario. So this has helped them a lot, so that we can take a decision of the prioritization of the situation earlier. Inside the ICU, you need to be around the patient's visibility area of the monitor, because you need to keep a check on the monitors which is connected to the patient directly. So you should be around the area, either the nurse or the clinician. He has to visibly check it. And plus, it gives on and off alarm, which will be it will increase the anxiety level of the patient. Definitely, if it is alarming on the bedside, one parameter that has gone up, so including all the 4 parameters can suddenly go up, and the anxiety level of the patient increases. His sleep gets disturbed. These are some of the things that we have observed in the ICU. Whereas in the rooms, you can give this enhanced connected care gives a silent alert to the required person. If it has to come to me, it will come only to the clinician or the charge nurses or the nursing officer who is on the floor, so that they can intervene and take an action when it's necessary. Whereas the patient's sleep will not be disturbed, the anxiety level doesn't get disturbed, they have a comfortable rest at the same time when we are monitoring them. So that adds to the benefit and the advantage of the enhanced connected care. Yes, definitely. Being in a very vulnerable area like oncology critical care area, which we are right now, we really feel that someone should be there with the patient all the time, who knows everything about the patient or the condition of the patient, what parameters need to be kept and what parameters need to be monitored in a regular level. We have incidences where the patient was monitored, and it helped us in preventing major catastrophe of the patient's condition. So it has helped us in not moving the patient right time to the ICU and right time to the OT, so that the patient's life was saved. It has happened, and that's why most of our clinicians are now vouching, okay, yes, put on life science. They themselves come and tell us, go ahead with putting the life science or enhanced connected care, because they know they can't go, the nurse can't be there in one single room, and the ward situations and other setups, where not in ICU but in ward setups, they can't be restrict themselves to one. And not only about the manpower, it's about the efficiency. The alert comes in the common place where we can all visualize the alerts, and we all can take an action, including our duty RMO. He can sit there and he can visualize any changes in the alert, and immediately it has helped us to record the basic parameters, vital signs, not going to the bedside and checking. We have come a long way ahead, so we don't have to go and check the temperature, go and check the BP. The nurses' work is eased in that also. So they really feel blessed that this is there for that patient, so we don't have to go on and off and ask them to put a BP cuff, ask them to take a temperature. So it has eased them also. But at the same time, in regards to the code blue alerts, it has really come down a lot. We have reduced on our met calls. We have reduced, now we only have pre-mets. That means before a met, we have agreed, we are being able to settle the patient and take the necessary decisions. Definitely. Post-COVID era, we all have gone through that COVID era, post-pandemic. Really, life science, I wish it would have been there before. We could have helped out many patients who were not being able to get to the hospitals in time. So definitely, life science has improved the care of the patient safety also, because when we are not available physically, we can get to know the patient's condition, ask someone to report there immediately and get in touch with the patient so that something can be done for the benefit of the patient. So definitely life science is an innovative thing that has happened for the patient's safety, for the patient's care, and has benefited all of us, the clinicians, the nurses, and the people who are around taking care of the patient. So it has improved the total the activity of the patient also will improve slowly, because the patient will have some remote thinking that yes, someone is monitoring me when I am all alone. If you consider about the technology being involved in all the equipments or things around us for the benefit of the patient, especially when we are in the advanced era, we need to think about making the life comfortable for the patient, as well as for our clinicians who are always busy. In regards to that, the life science has helped us a lot, especially when the patient is ambulatory. Even then you can keep a check on the patient's activities. Plus now we have got even the remote home advanced one, which is helping us to monitor the patient who is in the vicinity or around us, and we can keep a track. When I am sitting here doing my OPD, or the clinician is doing OPD, or I am doing my usual routine work, I can keep a track of my relative or my patient who is at home. So that has really helped us and we should be using the life science for those conditions.